Hey guys, so hope you are doing well. So today we are going to talk about tuberculosis. So let's get. So today we are going to learn about introduction of the tuberculosis, definition of the tuberculosis, causative organism of tuberculosis and etiology of tuberculosis. So before we move on, let's just talk about that this video will be further continue in other part. So today we are going to learn only about this section, okay? So tuberculosis is nothing but it's a bacteria, so it causes infection. Now basically this is the tuberculosis is the communicable infections, or we could say that it infects from one person to the another when one person comes in the contact with the infected person. Okay, so tuberculosis is one of the most prevalent infection of human being and contributes considerably to illness and death around the world. It is spread by inhaling tiny droplets of saliva from the cough or sneeze of an infected person. It is slowly spreading chronic granulomatous bacteria infection characterized by gradual weight loss. TB is the world's second most common cause of death from infectious disease. So basically, TB is there are many types of TB, but it mainly affects or primarily infects the lungs, parenchymal lungs tissue. Okay, so it infects the lungs. Let's see definition. Tuberculosis is the infectious disease primarily affecting lung parenchyma. Is most often caused by Mycobacterium tuberculosis. It may spread to any part of the body, including meninges, kidney, bones, lymph nodes. So TB is the infectious disease and is primarily affecting lung parenchyma. It is a tissue of the lung which is get affected by the tuberculosis and is the most common cause of this disease is Mycobacterium tuberculosis. Now remember, Mycobacterium tuberculosis is only the causative organism in the human. Okay, there are many other causative organism in animals too, so just we have to remember it that Mycobacterium tuberculosis is only the causative organism in the human. Okay, and there are many varieties of the tuberculosis. It may spread to any part of the body, including meninges, kidney, bones, lymph nodes. So it can be spread to any part of the body. Okay, now tuberculosis is derived from the Latin word which is tuberculum, that is small swelling, or we could say it nodules. Now the causative organism of the tuberculosis, as we have earlier discussed about the tuberculosis, in which Mycobacterium tuberculosis is the common causative organism in the human, and Mycobacterium bovis, which is the causative organism of animals. And the other causative organisms are Mycobacterium africanum, Mycobacterium microti, Mycobacterium leprae, Mycobacterium avium, Mycobacterium asiaticum. Okay, so Mycobacterium leprae is the leprosy, is nothing but the leprosy, and it can also be seen in the human too. Okay, so we'll discuss it later about leprosy. Now we are discussing about the tuberculosis, so let's get further and we learn. And now we are learning about etiology of the tuberculosis. TB is caused by tubercle bacilli, which belongs to genus Mycobacterium. This form a large group but only three relatives: Mycobacterium tuberculosis complex, atypical Mycobacterium bacteria, which are found in the soil, milk and water. So as we have already discussed about how it is caused. Okay, so basically if one person is infected, he sneezes or he just cough in a public area, or in a uh, or in a public area, if the person is nearly about the infected person, then he's most or he's there are more chances that he could get developed from TB. Okay, now basically tuberculosis are of two types: latent and the active TB. Latent TB does not cause uh, does not causes symptoms, as the person might be having a good immunity, or it may be there are less tubercle bacilli that are insufficient to cause infection. So as we have seen, Mycobacterium tuberculosis complex. So it could be Mycobacterium microti, Mycobacterium africanum, Mycobacterium leprae, and Mycobacterium asiaticum. Okay, and as we have seen, atypical mycobacteria is commonly found in soil, milk, and water. Okay, so the following people are at a high risk for active TB. So what are the types, or what are the peoples that are more likely to develop this infection? So let's discuss about this topic. uh, Basically tuberculosis are can be seen in the patient or in the person who have less immunity, or who are immunocompromised, or taking any drugs that that could reduces the immunity of the person. Okay, so these are most likely to be there, these peoples are most likely to be develop infectious disease, oh sorry, tuberculosis. So elderly patient are most likely to develop active TB. Remember, this is active TB, not a latent TB. Latent TB can be found in many person, or in can be found in many person, but there are no symptoms. So it is difficult to diagnose it, but there are many various diagnostic technique that could be used to find the latent TB, and it can be cured by certain drugs, and we'll discuss it further in the next video. Okay, and infants are also most likely at a high risk of active TB. Immunocompromised. Okay, so infants are also at a high risk for active tuberculosis. Immunocompromised, as I have already discussed about the immunocompromised person who is having uh, immunocompromised, like a patient, a person or a patient is already having HIV, or is suffering from the HIV infection, are at a high risk for the active TB. As we know that HIV uh, doesn't make person die due to HIV. A person doesn't die due to HIV, but is died due to other infection, and opportunistic infection. We could most more specifically we could call it as an opportunistic infections. If a person is diabetic, or having any type of immunocompromised, or if a person is taking a steroidal drugs, is also at a high risk of TB. So risk of TB increases if person is frequently contact with the people who have TB. Okay, now we could say that it's a preventive measure, that if a person is diagnosed with the active TB form, then it should be there should be a maintained proper distance between the infected person and the normal healthy person. So the patient should be kept isolated. Okay, as we have seen in the corona phases. Okay, or if the person is malnourished, is also at a high risk of TB. Okay, it is also at a high risk to be get infected with the TB. If a person is living in a crowded or unsanitary living condition, is also at a high risk to get TB. Okay, and the person is suffering from HIV infection, is also at a risk of TB, is also at a high risk of it is also at a high risk to develop HIV. Oh, sorry, it's also developed to high risk of TB infection. Okay, now as we have seen that the TB is basically found in developing countries. Okay, as compared to the developed countries. Okay, so there are less cases, or we could say that there are almost no cases of TB in developed countries as compared to the developing countries. So we'll discuss further about TB in next video. So do subscribe to our channel, like it, and do share it with your friends so that your friend get this information for the examination. Okay, thank you so much. Bye.